Fife will want to know what we've got wrong and what we need to do to get back to level 2. Over the last few months and in other areas of Scotland, the First Minister has been able to say it's been pubs or indoor social gatherings. So what data is available from testing and tracing about the spread and the cause of the spread in Fife, as well as Angus and Perth and Kinross? The First Minister knows I am frustrated about the Scottish Government's slow pace of progress on testing. If they are testing all students in England for Christmas, what is stopping the First Minister doing the same for students in Scotland?
First Minister.
The only thing stopping me right now is the need to advise Parliament first, which the presiding officer I'm sure would insist on, and of course the Higher Education Minister will make a statement to Parliament tomorrow, setting out plans on that, and I am sure Willie Rennie will be heartened and encouraged by what he hears in that statement. We have a supply of what are called lateral flow testing devices. We are currently looking at the logistics of exactly how and the clinical prioritisation of using these, but without preempting the statement that will be made tomorrow, students will clearly be a priority for that. So I hope Willie Rennie will be happy when he hears Richard Lockhead's statement tomorrow. Can I say to Willie Rennie, I think we've got to be really careful, and I mean this genuinely, to use language like, what has Fife done wrong? This is an infectious virus in a global pandemic. With the best will in the world, sometimes people get it and sometimes people transmit it, and sometimes it can run out of control for a period. I think we've got to be careful about language that suggests people are to blame for that. However, it is important that we make very clear that all of us, through our individual actions, can help minimise that. We can't guarantee we won't get it, we can't guarantee we won't pass it on, but by following the facts advice, by abiding by all restrictions, we can minimise the chances. There will be the situation in Fife right now. It has accelerated quite quickly. The figure I gave earlier on is that over the past week, and these are figures going up to the 6th of November, there's been a 40% increase in the cases per 100,000 of population. Over the same period, the positivity test rate has gone up by 1.5%. We have a rising projection for hospital and ICU admissions, although we are not at the moment seeing these being breached in Fife. There is not yet an absolutely clear understanding of exactly what the drivers of that might be, although the information that comes out of Test and Protect suggesting the contacts people have had in the 7 days before testing positive will be looked at in order to try to inform the local response to this. That is information that is provided through Test and Protect, Public Health Scotland reports, but some of the information that I have set out just in the last few minutes is published today, and all members can go and look at it. And the hope is, with Fife, with Perth and Kinross and with Angus, acting quickly here, as we have reason to believe might be happening in Dundee, will bring this under control and lead to these areas being in tougher restrictions for a shorter period than might be the case if we waited and it ran further out of control.